Lobotomies read like something out of science fiction, a probe inserted through the eye to sever brain connections. But it's not a storyline from The Twilight Zone or Doctor Who. Lobotomies were once a widely practiced form of psychosurgery used to treat everything from insomnia to schizophrenia. In this episode of Well I Never, we explore the complex, dark, and still ongoing tale of Dr. Walter Freeman's transorbital lobotomies. Before we begin, I'd like to thank this episode's sponsor, you. Support from our viewers, patrons, and channel members not only helps to keep the channel releasing episodes consistently, but also helps us to head to locations of historic and often dark events. If you're a member or patron, you also get access to bonus episodes and early releases. So once again, a big thank you to you all. Now, on with the show. The history of mental illness treatment is one of incredible sadness, cruelty, and abuse. From 18th century Europe's treatment of mental illness as a moral failing to ancient practices of bleeding, purging, and induced vomiting to correct imbalances, and even exorcisms. People with mental illnesses have been subjected to some truly appalling care over the centuries. But one more modern treatment is perhaps the most shocking of all. In the early 20th century, mental health facilities were filling past capacity at an alarming rate. There was little in the way of effective medical treatment, and the sudden need for advanced options spurred what was known as the experimental era, an onslaught of radical and invasive therapies. These included insulin shock therapy, which involved administering large doses of the hormone to send patients into short daily comas. These often resulted in the patient suffering seizures, which some psychiatrists regarded as therapeutic. Malarial therapy, which, as you may imagine, involved intentionally giving the patient malaria, the thought being the fever caused would flush out any other problems. And electroconvulsive shock therapy, where electricity is used once again to induce seizures. Along with these treatments, doctors also began experimenting with surgical operations on the brains of those deemed insane, ushering in the terrible era of psychosurgeries and the lobotomy. Modern psychosurgeries date back to the late 1800s, but it was in 1935 that a Portuguese neurologist named Antonio Egas Moniz developed a brain operation he called a lobotomy at a Lisbon hospital. The procedure used to treat mental illness involved drilling holes in the patient's skull to access the brain, through which a sharp instrument was inserted and swept from side to side, severing the connection between the frontal lobes and the rest of the brain. Moniz wrote of his procedure, quote, "I decided to sever the connecting fibers of the neurons in activity," end quote. He believed patients with obsessive behavior were suffering from fixation of synapses. Synapses being the link between the neurons in the brain over which electrical signals are sent and received. He believed that these could become clustered in a way that would lead to a person having obsessive thoughts or ideas. The initial procedure performed by neurosurgeon Almeida Lima was deemed a success. The patient, a woman suffering from severe depression, did in fact no longer appear depressed. Moniz chalked it up as a win, even though the patient would never be discharged from the mental hospital. 20 others underwent the treatment, and the doctor reported dramatic improvements in all, writing in his reports that declared his patients were cured within days of undergoing the procedure. He would publish his findings a month later. His results were met with overall hostility and doubt from the medical community. A doctor who had supplied patients for the second cohort of his experimental lobotomies denounced the technique, stating that the patients who had been returned to his care post-operation were diminished and suffered a degradation of personality. He also claimed that the positive effects Moniz reported were more likely properly attributed to shock and brain trauma. Parisian psychiatrist Paul Corborn stated his refusal to endorse an operation that was supported solely by theoretical considerations rather than clinical observations. He also pointed out that the mutilation of an organ could not improve its function, and that such wounds left patients more likely to develop meningitis, epilepsy, and brain abscesses. But some physicians were impressed with Moniz's results and, lacking any better treatments, embraced the method. In 1949, his work would lead to Moniz receiving a Nobel Prize. In the US, neurologist Walter Freeman seized on his work with enthusiasm. He quickly became an evangelist for what was now popularly known as the lobotomy after a chance meeting with Moniz in London. With this, he wasted no time in initiating the first procedure in the US in 1936. His patient was a Kansas housewife whom Freeman believed was suffering from an overload of emotions. He thought that cutting certain nerves in the brain could eliminate excess emotions and stabilize a personality. Along with his colleague James Watts, Freeman completed the first American procedure at the George Washington University Hospital on September the 14th after months of correspondence with Moniz. 63-year-old Alice Hood Hammett became the first lobotomized person in the US. Heartened by the results from their procedure, Freeman and Watts set about adapting and improving it into a more precise operation, known as the Freeman-Watts standard prefrontal lobotomy. The duo performed hundreds of these operations, including that of Rosemary Kennedy in 1941. The technique still required the drilling of holes into the skull, so surgery had to be performed in an operating room by trained neurosurgeons. Freeman disliked that so many would therefore not be able to access what he believed was a revolutionary treatment. State mental hospitals had no operating rooms, surgeons, or anesthesia. He envisioned a simplified procedure that could be carried out in an office setting. Inspired by the work of Italian psychiatrist Amaro Fiamberti, who had performed over 100 leucotomies accessing the frontal lobes through the eye sockets, Freeman began experimenting. In his own kitchen, he began testing ice picks on grapefruits and eventually moved on to cadavers. His new transorbital lobotomy involved lifting the upper eyelid and placing the point of a thin surgical instrument under it and against the top of the eye socket, using a mallet to drive the instrument, often called an orbitoclast, through the thin layer of bone. The doctor then pivoted it back and forth to sever the white fibrous matter, connecting the cortical tissue of the prefrontal cortex to the thalamus. The orbitoclast was then removed and the procedure repeated in the other eye socket. The first of these transorbital lobotomies to be performed on a live patient took place in 1946. Freeman had transformed a surgical brain operation into a simple office procedure, and he was ecstatic with the results. But his partner, Watts, was disgusted by the modification and ended their partnership. The pair had already performed over 200 lobotomy procedures and published results claiming that 63% of patients had improved. But undertaking a procedure commonly labelled the ice pick lobotomy, which required no anesthesia, was a step too far for Watts. Undeterred, Freeman travelled across the country visiting mental institutions to perform lobotomies and teach his methods to the staff. To say his technique caught on would be an understatement. In 1949 alone, over 5,000 lobotomies were performed in the US. Freeman lobotomized patients across 23 states. The procedure took only minutes to perform, and he charged just $25 a pop, roughly $550 today. Despite having no surgical training, he had become the foremost expert in brain-altering mental illness treatments. In July of 1952, Freeman performed an astonishing 228 transorbital lobotomies in a 2-week period in West Virginia for a state-sponsored lobotomy project dubbed Operation Icepick by newspapers. In 1954, the introduction of the antipsychotic medication chlorpromazine caused a decline in widespread use of lobotomies. Freeman retired from his position at George Washington University and opened a private practice in Sunnyvale, California, where he continued to peddle his procedure to desperate families and patients. He promised them it could treat schizophrenia, chronic pain, and suicidal depression. Indeed, according to a New York Times article from 1937, anyone with the following symptoms could benefit from a lobotomy: tension, apprehension, anxiety, depression, insomnia, suicidal ideas, hallucinations, crying spells, melancholia, obsessions, panic states, disorientation, psychalgia, nervous indigestion, and hysterical paralysis. Many patients who underwent the procedure seemed to emerge in a new, relaxed state. Lots of patients and families were pleased with their results. Patricia Mohn, who was lobotomized by Freeman for suicidal depression, told NPR in 2005, quote, "I was a more free person after I had it. Just not to be so concerned about things. I went home and started living. My guess is the best I can say. Just started living again and was able to get back into taking care of things and cooking and shopping and that kind of thing." End quote. Her husband Glenn, who signed the release for the procedure, added that he was delighted at the way it turned out. It's been a good life. But many patients were not as lucky as Patricia. As many as 100 of Freeman's patients died of cerebral hemorrhaging following the procedure. Many had to be retaught how to perform basic tasks like eating and going to the bathroom. In 1951, the often blasé nature of Walter's approach led to the death of a patient after Freeman paused midway through the operation to have his photo taken. During the impromptu photo shoot, the orbitoclast sank deep into the patient's brain and killed them. Alongside this tragedy, many, like Rosemary Kennedy, were left with severe mental and physical disabilities. Others appeared almost lifeless, lacking all personality and emotion. Dr. Elliot Wallenstein, who wrote Great and Desperate Cures, said of the procedure, quote, "There were some very unpleasant results, very tragic results, and some excellent results, and a lot in between." End quote. In short, the lobotomy did not provide consistent results we would expect from a widely practiced procedure today. Walter's approach to the surgery became increasingly careless. He'd often not wear a mask or gloves, and he also seemed to care little about the ability of his patients to give consent. Such was the case with 12-year-old Howard Dully. Howard was brought to Freeman by his stepmother, Lou Dully. She told the doctor she feared her stepson. She described the boy as defiant and savage-looking and told Freeman that he reacted to neither affection nor punishment, objected to going to bed, and spent too much time daydreaming. On Freeman's advice, Mr. and Mrs. Dully decided to lobotomize Howard. They kept the procedure a secret from the boy, not even telling him what had been done until 2.5 weeks after the lobotomy was performed. Following the procedure, Howard was not the well-behaved son Lou wished for, but a shell of a human, silent, grinning, and despondent. Frustrated with the results, Lou Dully forced Howard out of the house and he became a ward of the state. Howard Dully worked his entire life to overcome the obstacles created by his lobotomy. It wasn't until 40 years later that he would discuss the procedure with his father, Rodney Dully. He explained to Howard that his stepmother had taken him to several other doctors who all agreed he was a perfectly normal young boy, just one grieving the loss of his mother, who had died of cancer when he was 5, and adjusting to life with a new stepmom. Lou finally found what she was looking for with Freeman, who quickly diagnosed the child with schizophrenia and immediately suggested his brutal cure. Rodney says he was manipulated by his wife and Freeman into allowing the procedure to go ahead. Howard went on to write a memoir about his experience as a lobotomized person. Howard was far from the only miner to go under Walter's ice pick, with it said that he lobotomized at least 19, with the youngest being just 4 years old. Unsurprisingly, there are other stories like Dully's. Anita Johnson McGee was lobotomized for postpartum depression and spent the rest of her life in mental institutions. Anna Ruth Channels was referred to Freeman for treatment of severe headaches. The headaches went away, but so did everything else, as Channels was left with the mind of a child. And Helen Mortensen, a housewife, prescribed her 3rd lobotomy by Freeman, became his last ever patient after dying from a cerebral hemorrhage. Freeman would eventually be barred from performing surgery in 1967. It is estimated that over his career, Walter Freeman personally performed as many as 4,000 lobotomies and worked tirelessly to endorse the procedure for thousands more. In the United States alone, approximately 40,000 people underwent the operation. In England, another 17,000. Scandinavian hospitals lobotomized 2.5 times as many people per capita than the US. In Japan, they were performed mainly on children with behavioral issues. As antipsychotic and antidepressant drugs proved more effective in treating mental illness through the mid-1950s and beyond, the practice gradually began to fall out of favor. By the 1970s, many countries and several US states had banned the procedure, and in 1977, US Congress concluded that psychosurgeries like lobotomies should be used only in extreme and rare circumstances. Today, there are calls for the Nobel Foundation to rescind the prize granted to Moniz for his development of the lobotomy. It is a procedure still occasionally performed alongside shock therapy and other psychosurgeries, such as the removal of specific regions of the brain to treat patients whose symptoms have resisted all other treatments. The history of lobotomies is one that is full of some stories of hope and gratitude, and many of forced procedures, regret and death. Howard Dully says of his experience, quote, "We are all victims of what is done to us. We can either use that as an excuse for failure, knowing that if we fail, it isn't really our fault, or we can say, I want something better than that. I deserve something better than that, and I'm going to try to make myself a life worth living." End quote. While his story is one of hope, sadly, many lobotomized patients were left with the inability to make any decisions about themselves for the rest of their lives after going under the ice pick. Thank you for watching. Your support is greatly appreciated. Right then, take care, and I'll see you next time with another story to make you say, "Well, I never."